Obsessive Compulsive Disorder, OCD, is a common mental illness in which a person has obsessive thoughts and compulsive behavior. OCD can affect men, women and children. Some people develop symptoms early, often during puberty, but it usually begins in early adulthood. OCD can be distressing and significantly interfere with your life, but treatment can help you keep it under control. If you have OCD, you usually experience frequent intrusive thoughts and compulsive behavior. An obsessive thought is an unwanted and unpleasant thought, image, or urge that constantly pops into your head, causing you to feel anxious, disgusted, or worried. Compulsive behavior is a repetitive behavior or mental action that you feel you need to perform to temporarily relieve the discomfort caused by the compulsive thought. For example, a person with a compulsive fear of being robbed may think that he needs to check all the windows and doors several times for locks before leaving the house. In women, OCD sometimes occurs during pregnancy or after the birth of a child. Obsessive thoughts may include fears of harming the baby or not properly sterilizing feeding bottles. Obsessive behaviors such as constantly checking the baby's breathing can be compulsive. People with OCD are often reluctant to seek help because they are ashamed or embarrassed. OCD is a health condition just like any other, so there is nothing shameful or embarrassing about it. Having OCD does not mean you are crazy, nor are you to blame for having it. There are two main ways to get help. Go directly to a psychological therapy service. See your therapist. He or she will ask about your symptoms and refer you to a local psychological therapy. It is unclear what causes OCD. Various factors may play a role, including family history. The likelihood of developing OCD is higher if a family member suffers from the disorder, possibly because of your genes. Differences in the brain. Some people with OCD have areas in the brain with unusually high activity or low levels of a chemical called serotonin. Life events. OCD may be more prevalent in people who have been bullied, abuse or neglect, and it sometimes begins after important life events, such as the birth of a child or bereavement. Personality. Neat, meticulous, methodical people with high personal standards may be more prone to develop OCD. Also, people who are generally quite anxious or have a very strong sense of responsibility for themselves and others. And now we take a look at 5 successful celebrities who have or have had mild or severe symptoms of OCD. Cameron Diaz, star of such films as The Mask and There's Something About Mary, admitted in a 1997 article that she suffered from a phobia of germs that caused her to clean the doorknobs in her house so many times that she faded their paint. She has since made her peace with this phobia, she says. She even removed stitches from The Daily Show host Jon Stewart's wrist on camera. Titanic and Shutter Island star Leonardo Dicaprio was obsessed with sidewalks as a child, often going back over his walking routes to repeatedly step on cracks or gum stains. Despite these compulsive tendencies, the actor states he does not suffer with OCD. DiCaprio admits he allowed his compulsive tendencies to worsen in order to better play his role as film producer, director and fellow OCD sufferer Howard Hughes in the movie Aviator. Star Katy Perry's medical records also include a diagnosis of obsessive compulsive disorder. The famous singer constantly feels the urge to brush her teeth. Perry admitted that 5 to 6 times a day. Perry admitted that brushing her teeth 5 to 6 times a day is not the limit. She can spend an hour on it. Katy once said that she almost never leaves home without a toothbrush. International soccer star David Beckham admits to keeping things in straight lines, pairing items and organizing them by color or type. According to his wife Victoria, Beckham once purchased 3 refrigerators so that he can have one for drinks, one for salads, and one for other foods. The items must be symmetrical as well. If there's 3 cans of Diet Coke, he'd throw one away instead of having 3, because it has to be an even number. Beckham admits he's tried to stop the behavior, but can't. Famous actress Charlize Theron said that because of OCD she cannot sleep well at night. Most of all, the star worries about the order in the closets. She constantly thinks that things on the shelves are not as they should be. Theron can get up in the middle of the night to check whether items of clothing are in their places, and put in order in the closet once again. It is noteworthy that the order on the shelves bothers Charlize not only at home, but also when she is visiting friends. A woman doesn't have to be or seem perfect to a man. Instead, he wants 3 simple things from you. Follow the link in the description of this video and find out what 3 healthy ways, 3 steps, you need to take to make your man go crazy for you. We wish you a healthy and strong relationship. See you soon.